full term with no NICU admission. At age of 1 month, rashes appeared over both upper and lower limbs and was diagnosed as eczema. His IgE level was 1,500 and no further investigations were done at that time. It was partially improved on topical steroids. At age of 2 years, he had recurrent attacks of chronic watery diarrhea and failure to gain weight, and was repeatedly admitted at GI unit with improvement on antibiotics and IV fluids. At age of 4 years, he had polyuria, weight loss, and came to the ER with high-grade fever, tachypnea, and severe dehydration, and diagnosed with DKA and bronchopneumonia and admitted to the ICU unit. His height for age was at minus 1.8 standard deviations. Inside the target centile range. His BMI was at the 3rd percentile with failure to thrive. After DKA control, we gathered our data. Here is a patient with type 1 diabetes, chronic diarrhea, and stunted growth. So we thought about celiac disease and did celiac screening. Anti-tissue transglutaminase IgA was positive with normal IgA level. Duodenal biopsy was ordered and showed duodenitis and lymphocytic infiltration, so diagnosed as celiac screening beside type 1 diabetes. After diagnosis, the mother had refused the gluten-free diet as advised, with irregular visits and poor compliance due to financial and availability issues. He was admitted many times with repeated chest infection and gastroenteritis, and at the age of 9 years, he came again with uncontrolled diabetes, bronchopneumonia, and bilateral lower limb edema. On physical examination, he had pale clubbing and purpura. Also, there was eczema over lower limbs, and Anthropometrics were deteriorated with the BMI below the 3rd percentile. Also, abdominal examination showed hepatomegaly. Cardiac and neurological examination were free. After stabilization, some investigations were done for complete evaluation of the case and revealed microcytic normocytic normochromic anemia with thrombocytopenia. Renal functions were normal. Liver enzymes were normal with hypoalbuminemia. Hemoglobin A1C was 12, indicating poor glycemic control with glucosuria in the urine analysis. Thyroid functions were done with primary hypothyroidism. So we did antithyroid antibodies, which were positive, denoting autoimmune thyroiditis. Also, anti-enterocytes and antiplatelets were done and were positive. Torch screening and Epstein-Barr viral capsid antigen were positive for old herpes simplex and Epstein-Barr virus infection. CD4 and CD4-8 ratio were low, with high IgE and normal IgG, IgA, and IgM levels. Bone marrow aspiration was done, revealing hypercellular bone marrow with mild inhibition of granulopoiesis, and blast cells were 1%. To collect our data, we have here a male patient with type 1 diabetes, chronic diarrhea, immune thyroiditis, immune thrombocytopenia, picture of primary immune deficiency, and eczema. So we have here immune dysregulation, polyendocrinopathy, enteropathy, and the X4, the X-linked disease, IPEX syndrome, or immune dysregulation, polyendocrinopathy, enteropathy, X-linked syndrome. It was first described at 1982 with prevalence less than 1 in 1 million people. About the etiology, it is due to loss of function, loss of function gene mutation of FOXP3, which was first described at 2000s, and it is responsible for the function of T regulatory cells, which are responsible for immune suppression, with presentation of low interleukin 10 and high IgE levels. This case frequently presents with early onset severe watery diarrhea, type 1 diabetes mellitus, and severe atopy with eosinophilia, or the 3Ds, diarrhea, dermatosis, and diabetes. Sometimes presents with thyroiditis, thrombocytopenia, as our case, or immune hemolytic anemia, nephropathy, or autoimmune hepatitis. Sometimes presents with splenomegaly or lymphadenopathy. This disease have disease flares like SLE with acute exacerbations triggered by infection, vaccines, dietary allergens, and manifested by severe watery diarrhea, exacerbations of dermatitis, and refractory hyperglycemia. About the management, it is mainly supportive therapy to control the diabetes, give blood products, parenteral nutrition, and immune modulators. The immune modulators here could be a high dose of steroids, cyclosporin or methotrexate, or other immune modulators. But remains the only curative treatment is hematopoietic stem cell transplantation. And thank you.
جلسات المؤتمر كلها رائعة، بس الجلسة دي لها طعم خاص، لأنها يعني حقيقة يعني ادتني أنا الأمان إن قسم طب الأطفال دايما هيبقى في تقدم، وأنا مطمئن إن شاء الله بعد عمر إن شاء الله إن في ناس هتشيل الرسالة كويس قوي قوي، وهيتنا اسم قسم طب أطفال طنطا موجود في كل مكان في جمهورية مصر العربية. فشكرا لكم يعني على هذا الأداء، وعشان كده قررت اللجنة مكافأة الثلاثة بدون تصويت.